starting to get on my nerves.
What's wrong?
Joe, he keeps coming to report later and later every day. You know, I've got things to do. I've got cats at home. If I'm not home on time, they start eating my plants and peeing in my shoes, and it's just a mess. And it's not fair.
Yeah, that wouldn't be good.
No.
I've noticed he's been acting different too. I guess what have you noticed that's been specific?
Well, we both got short sleeve t-shirts on. It's like 90 degrees in here, and he's been wearing these stupid long sleeve t-shirts. His face is always like blank stare, and it looks like nothing's going on in there. You know, Sherry said last night he took about 5 breaks on his shift, and they were all 15 to 20 minutes long apiece.
Wow, I guess I really haven't thought about it. I mean, I noticed that I was having to pick up his call lights, and I mean, I can hardly get my own caseload, and now I have to answer his call lights.
Yeah, it's ridiculous. And his reports suck. He knows nothing about his patients. I don't even know if he looks at them all night and does an assessment. Only thing he knows is what they got for pain meds and how their pain level's been during the night. He knows nothing else. His charting is horrible. We don't know what's going on during his shift. And he's been making a couple mistakes lately, which he just happens to pass off as being somebody else's fault. I'm really worried about patient safety with him, and I'm thinking about going and talking to the manager about it.
It's probably a good idea.
Yeah.
What's up, dogs? No fear, Joe's here.
Hey, Joe. Good job. 20 minutes late, buddy.
Hey, take a chill pill. I'm not that late. Besides, this time it was my dog's fault. He never listens.
I didn't know you had a dog. I thought you were allergic to dogs.
You must have me confused with someone else.
All right, guys, I'm going to start my assessment.
All right, see you, Erica. See ya. How you been doing lately, Joe?
I've been fine. Why?
You just seem to be acting strange. You got any stress going on in your life, or what's going on?
No, I'm okay.
Okay.
Thanks for asking.
Yeah. Are you ready for a report?
I suppose.
Okay. In room 34, we have Mrs. Smith. She's a 30-year-old patient, female, who slipped and fell on the ice yesterday. She had her surgery yesterday. Her CTMS has been good. Her pain has been kind of high. She's been rating it 5 or 6 all night. I've been giving her scheduled meds, her scheduled pain meds, but they, you know, you might want to look at it this morning, especially since physical therapy is going to come and they're going to ambulate her early, so.
I'll take care of it right away. I'll call the doctor, see if they'll order Demerol or morphine for her.
Oh, okay. Good. Thank you. That would be very helpful.
Oh, I will. Everyone needs their pain under control. What else you got? Anybody else with narcs?
Well, no. We have Mrs. Jones. She's in room 36. She came in yesterday. She had her appendix removed. She seems to be doing fine. I haven't noticed any signs of infection with her sites or anything. She hasn't been complaining of any pain. She's rating it at a 0 all night long. I would just, you know, keep an eye on her. She's planning on going home today, so.
No pain, huh? Does she have anything ordered for pain?
No, you know, honestly, it was such a crazy night. I didn't even look. She hasn't been complaining of pain. She said her pain all night was a 0, so I haven't needed to look.
Well, I'll check. What else you got?
Nothing. That's the end of my report. I need to go home and take care of my cats, so.
Well, have a good day. I know I will. Hey, Mrs. Jones, how are you feeling today?
I'm feeling good, thanks.
You need anything for pain?
No, I think I'm fine.
Are you sure?
Good. Yeah, I'm feeling fine today.
Positive, 100%? You don't need anything?
I'm positive. I feel good. I just want to go home.
I see you have Darvocet ordered if you need it.
I don't even think I know what that is.
Okay, more for me.
What did you just say?
Oh, nothing. What's up, Mrs. Smith? How's the pain?
Hey! Oh my gosh! Do you realize I just had hip surgery?
Oh, I'm sorry. Did it hurt pretty bad?
What do you think?
I don't know, rated on a 1 to 10 scale.
It's
What
a
would it be?
15.
15? Oh, man.
All I'm getting is this Vicodin. It's not doing anything for it.
Okay, I can take care of it.
I thought somebody was going to have, you know, some morphine or Demerol or something for me.
I'll see what I can do. I'll see if I can get some morphine ordered.
Like, as soon as possible?
All right.
I'm so addicted to all the things you do.
Here's your morphine, Mrs. Jones. I mean, Mrs. Smith.
Yeah. Oh, do you finally have something for me now?
I got it. This will make you feel better.
Okay, what is it?
It's morphine.
Okay.
Are you ready?
I've been ready.
How's
Okay.
that feel?
Not bad. And we'll see how I feel in a few minutes.
Should start
How-
working. I'll check back on you in 30 minutes or so.
30 minutes?
Maybe 40?
That long? I don't know if I can take it.
You gotta give it time to work.
I don't know if I can take it. I just don't know.
You can do it.
Well, check back in 10, and if it's not better, then I'm holding you accountable.
I'll be back.
Hi everyone. Thank you for coming to this in-service today regarding substance abuse. We have two guest speakers from the Health Professional Recovery Program. Up next is Kim.
Thank you. Hello, everyone.
Hi.
How are you?
Good.
Oh, I'm here. I'm here.
Hello, how are you today?
Good. How are you?
I am good. Thank you for joining us.
What are we doing?
We are talking about substance abuse today. When it comes to substance abuse, first of all, we need to remember that reporting inappropriate behavior by a nurse is to safeguard the patient, not to punish the individual with the problem. The Nurse Code of Ethics is intended to safeguard patients and the public when health care and safety are affected by the incompetent, unethical, or illegal practice of any person. Patients who are vulnerable have the right to safe, skilled care administered by a nurse who is mentally and physically able to perform certain nursing duties. Nurses also have an obligation to protect the organization in which they work by reporting impaired practice when it is observed. Usually impairment among nurses is first recognized by other coworkers. If a nurse suspects that a colleague has a substance abuse problem, it is best that he or she first talk to the suspected nurse about the situation discreetly and in a non-confrontational manner, because there may be a reasonable explanation for the suspicious behavior. Remember that nurses that abuse substances are usually bright and highly skilled in demanding jobs that involve responsibility and require commitment, and are ambitious and achievement-oriented individuals. An impaired nurse should not be allowed to practice, though the nurse needs to be encouraged to get professional help. Helping the impaired nurse is difficult, but not impossible. The choices for action are varied. The only choice that is clearly wrong is to do nothing. Documentation is also essential when it comes to confronting someone that is suspected of substance abuse. A log should be kept with times, dates, and the situation observed of the suspected nurse in order to have documentation to fall back on when it comes time to confront the nurse and support the claim. Nurse managers play a very important role when it comes to making sure patient safety is followed, and that nurses that work under them provide safe care. They need to watch for signs of impairment among nurses, such as deteriorating personal appearance. The manager needs to make sure that they follow all legal aspects when it comes to confronting a suspected nurse. They should discuss the concerns with human resources and the legal office before confronting the nurse. If there are suspicions that a nurse is impaired, the manager should set up a private meeting with the suspected nurse and talk about the concern. The manager should also make mandatory referral for counseling. If intervention by the manager does not work or counseling, an impaired nurse can be suspended, fired with or without reporting to the State Board of Nursing. Before I turn it over to the next guest speaker, does anyone have any questions? Yes?
What kind of things should we look for if we suspect somebody of substance abuse?
That is a very good question. A couple of examples would be changes in their job performance, changes in their personality, maybe different changes in the way they're behaving, poor attendance or showing up late for work, being very distracted, not answering the call lights, and just overall general appearance changes. Do you have any other questions at this time? Okay, now I'd like to turn it over to Melanie, and she's going to talk about the recovery process.
Thank you, Kim. How is everyone today?
Good.
Good. Well, as Kim stated, I'm going to be going over the recovery part. I'd like to begin by giving a little bit of background, background information in regards to the program. In 1974, the American Medical Association started to encourage state licensing boards to develop confidential and non-disciplinary programs for health professionals with substance abuse problems. In 1993, Michigan did get on board. It took a little while, but the Health Professional Recovery Program was established. The philosophy of the program is to provide health professionals an opportunity to enter into treatment and be able to recover from their disease early in the process. The program works to minimize negative impacts not only on the health professional, but also on their patients, their families, and their friends. Ultimately, we want to help and treat the abusing health professional so they avoid disciplinary action and get to keep their license and their job. Does anyone have any idea on how the nursing profession is impacted from substance abuse? No? Well, whether it's from alcohol or drug abuse or both, statistics show that 1 out of 10, so 10% of the total nursing population, do struggle with some form of substance abuse. In fact, several years ago, the program released a report that stated of the 1,400 participants involved, roughly 70% of them were nurses. So that's a pretty scary statistic, especially if you are a nurse. Getting back to the program, there are 3 steps that are involved. You have the intake phase, the monitoring phase, and then, of course, discharge upon completion. The intake phase consists of health professionals admitting themselves to the program. During this stage, they are evaluated, and it's determined if indeed they do have a condition that needs to be treated. Believe it or not every single person that admits themselves to the program will stay and be a part of the program. Within the, just to back up a little bit, if it is determined that the participant does have a condition that needs to be treated, a recovery monitoring agreement will be constructed for that individual, and it's very individualized. Within the agreement, it will state the terms and requirements to be followed by the participant. Examples include treatment appointments, if there's going to be any drug screening, attendance at individual or group therapy, and also the duration of the treatment. Once the agreement is signed, the first step of the program is considered to be completed. The second step of the program is the monitoring phase, where the participant does receive treatment and monitoring for the disease. This phase will typically last between 1 and 3 years. During the treatment, the participant can receive approval to return to work if their condition is considered to be stabilized. Of course, at any time, if the participant becomes non-compliant with therapy, they may be removed from their job and possibly even lose their license. The last step of the program is discharge. When the participant has successfully completed the monitoring phase, they will be considered discharged from the program. If participants at any time throughout the program are considered to be non-compliant, they can be discharged and referred to the Michigan Department of Community Health Bureau of Health Professionals, and disciplinary action can occur at that time. In other words, they may even lose their license as well as their job. Of course, it is our goal at the program for everyone to be able to return to work and live the rest of their life substance abuse free. Unfortunately, that doesn't always happen, but more than not, it does. Does anyone have any questions?
Where can we go if we wanted more information?
Well, there's actually a couple different places. We are on the web, so we have a website, Health Professional Recovery Program, as well as you can go to your local community mental health department. We're very involved through the health department as well, and then I will be leaving information with the nurse manager as well, so if there were any immediate questions. All right, well, thank you, everyone.
I better do a little more today.
I'm so addicted to all the things you do.
I need a nurse. sorry, Mrs. Smith. What's the matter?
I can't take it. My pain is just through the roof, and I don't know what's going on. I had a shot.
How long ago?
I don't know. It feels like forever ago. Probably close to an hour. He said he would check back, and he didn't, and I can't take it.
What's your pain level at right now?
It's like a 20. It's ridiculous.
Okay, I'll go check on
Something's
that.
wrong. I think
check.
something's wrong because I had that shot, and it didn't touch it. It's only getting worse.
Okay, I will check and see what the holdup is.
Okay.
Who's your nurse today?
Joe, I guess?
Okay, I'll be back and check.
Okay.
Where is Joe? Joe, are you sleeping?
What? No, I'm not sleeping. Why?
We gotta go do NARC count. I've been waiting for like 10 minutes.
Oh, I'm sorry. I was making sure this bud felt okay. Alright, what are we doing?
Right now, we're checking the Vicodin. There should be 5.
Yep.
All right, there should be 12 lower tab.
Yep.
Okay, there should be 2 Darvocet
Yep.
and 15 Tylenol 3s.
Yep.
All right.
That's it. They're all here. I'm gonna go off, give report.
Okay, don't take a nap this time.
Okay.
Hi, Ashley. I think we have a little problem. I was wondering if you could come up and meet with me. All right, I'll see you in about 10 minutes. Thanks. Bye.
What's going on?
I've been noticing some things about my coworker Joe. I really didn't think about it at all until I went to today's in-service, but he's been showing up late quite a bit to work, and the night nurse has been noticing. He's also been having sloppy charting. I've been having to answer a lot of his call lights. I've noticed that his main concern is the patient's pain level.
Mm-hmm.
He doesn't really seem to be concerned with the rest of it, and the night nurse said she didn't think that he was even doing assessments. So, I mean, it's great that he wants to be on top of pain, but I don't think that that should be his main concern, and I'm concerned with patient safety. And today we went to do NARC count, and I found him sleeping in one of the empty patient beds.
Well, thanks for bringing this to my attention. I will do some research and see what's going on with Joe.
Okay.
Hello, Mrs. Jones.
Hello.
I see that you are here for your appendix.
Yeah, I had surgery yesterday, but I'm feeling pretty good.
How's your pain management going with all of that?
Good. You guys seem to be really on top of that. My nurse seems to ask quite often about my pain.
On a scale of 0 to 10, how would you rate it?
0. I'm not having any pain. I'm ready to get out of here and go home.
Well, I can check on your discharge papers for you
Okay.
and get back with you later.
That would be great. Thank you.
for your time.
Thanks.
I see it says that she had gotten pain medication today. And it is missing. I'm sorry, Mrs. Jones. Did you say you had gotten pain medication today?
No, I haven't. I haven't had any all day.
Okay. Thank you for clarifying. Hi, Mrs. Smith.
Yes.
How are you feeling?
Well, I'm better now. I had a really rough morning. My pain was just unbearable. You know, I slipped and fell and broke my hip and had to have surgery, and it's just been a nightmare, and my pain was just undescribable. And you know, my nurse this morning, I think his name was Joe.
Okay.
Some nurse he is. I mean, granted, he gave me a shot, but it didn't do anything for me. And then I had this really nice girl that came in, and she gave me something through my IV, and it finally helped. So I don't know what it was. I think I heard her say something about morphine. So it finally helped. I mean, I still have pain, but it's not unbearable like it was. I'm able to get a little rest. So,
You're more comfortable now?
yeah,
Okay.
more than I was.
Good, okay,
Yeah.
good. Well, we'll keep track of your pain. I can promise you that, so it won't get that bad again.
Okay. Can she take care of me from now on? Because, you know, he's weird. And he was acting weird this morning, and, you know, I just would rather have her. She actually helped me, and I don't really want to see him again, so.
Okay, yep, we can see what we can do.
Well, thank
With
you.
other nurses on the floor too, we can get some things straightened out and switched around for you to
Good.
make your stay better.
Good, I appreciate it. Thank you.
Thank you for your time.
Thanks.
She was supposed to get morphine, and that should have helped with her pain. So I called this meeting with you because it has been brought to my attention that you are having difficulty at work and you might be abusing substances. Would you like to talk to me about it?
Well, to be honest, I have been going through a lot right now, and it got out of control, and I can't control it anymore.
Joe, did you attend the in-service on substance abuse?
I did, but I really wasn't paying attention.
Well, I think it would be in your best interest to check yourself into the Health Professional Recovery Program.
Am I going to lose my license and my job?
If you check yourself into the program and you follow the treatment and work hard to get your life back on track, you shouldn't lose your license or your job. I am hopeful that you will complete this treatment and return back to work.
I really do think I can overcome this with some help.
Do you ever feel like breaking down? Do you ever feel out of place? Like somehow you just don't belong and no one understands you? Do you ever want to